Chapter 18 is entitled Relational Practice in Nursing Obligations, written by Dona Varco in 2007. And in this specific chapter, the link between therapeutic and ethical relationships is explored, and the use of relational inquiry and how it can contribute to both ethical and therapeutic relationships is examined. So let's think of nursing's image. In the first chapter of the book, it says when people think of nursing, they no longer think of Florence Nightingale, the lady with the lamp out in the field of war, taking care of people. When people think of nursing, the general public, they think of someone who is overworked, underpaid, stressed, hurried. Those are some adjectives that come to mind. So it is the nurse's responsibility to foster therapeutic relationships in order to achieve good care outcomes. But how can this happen given that we are nursing in situations and environments that are complex and dealing with complex patients, complex problems? How can we meet all the demands that we have to meet in order to provide quality care? When we talk about nurse-patient relationships, there are a few assumptions that we can have. First of all, there's the assumption of therapeutic intent. And the basic belief is that nurses want to be genuinely responsive, compassionate, and they want to practice competently and ethically. However, there are all these extraneous variables that we've alluded to before that can impact the nurse relationship with the patient and affect the nurse's ability to have true presence and be in the moment with the patient, which is necessary for adopting a patient-centered care approach. So some of those variables that I talked about in the previous chapter was workload, acuity, staffing ratios, but also other factors can impact the nurse-patient relationship, like the nurse's own personal identity or social location in life. Both of those can affect a nurse's willingness to respond to specific patients and be receptive and open towards them. So the process of rational inquiry takes into account how relationships are formed and maintained and examines many factors that can impact those relationships. So when we talk about a good relationship, the literature suggests that good relationships are founded on respect, trust, and mutuality. So these three things are really important because those are principles that are observed when we provide ethical and effective care. And respect is really important because it fosters trust in a relationship. And trust is imperative if a patient is going to accept care that the nurse offers. On page 203 of your Caody text, characteristics of a trusting relationship are outlined. And some of those important characteristics are when the nurse treats others as worthy and equal, the nurse accepts others and their differences, the nurse is willing to listen to the patient, and the nurse attempts to genuinely understand the patient's situation, or, as we indicated earlier, their own personal biography, and the nurse is sincere or authentic. So in order for the nurse-patient relationship to be therapeutic and for nursing practice to be effective in addressing needs, the relational space for understanding needs to be created. And relational space are those moments in time, those very small windows, where we are able to identify and connect with our patients to better understand their story. And those relational space moments are impacted by competing values, demands, that are placed on the nurse. And there's a story in the book about how a little old lady presented to the emergency room and she had a gash on her leg, and the nurse was busy, had other patients, and didn't really have time at first to listen to the person's story, but briefly just asked one pointed question that allowed the person to ventilate what was going on in her life. And it was uncovered that, she was autonomous and independent before, and now, she was worried about, did her injury mean that she couldn't ever live on her own? So there are always greater meanings that can be uncovered when we give people the time to relay parts of their story. But in reality, it's not often easy to spend that time because you're thinking of all the things that you have to get done in your care. So the use of rational inquiry involves the specific obligation of being reflexive and intentional, being open to relational space for difficulty, examining our responses to particular situations while pursuing common nurse values and goals. So let's talk a little bit more about that. If we're going to use rational inquiry, that means we're going to have to think hard about our nursing values and obligations. We're going to have to identify some of the biases that could color the care that we want to offer our patients, or the patients, how we view the patients in our care. And we have to look at the patient holistically as a whole human being, not just the GI bleed in room 412. We need to look for opportunities to create those meaningful experiences and responses, even if those experiences are painful or difficult. So there might not be many windows where we can create that relational space. And sometimes we avoid things that are hard in clinical practice. And patients who are suffering or going through circumstances that are emotionally draining for them and emotionally draining for the nurse to deal with are hard to address. But when we open ourselves up to suffering, that can be a pathway to meet the relational obligations of both our patients and ourselves. So what is important to translate into practice regarding this? That if we look at care through a lens of rational inquiry, we can look at our praxis and the influences that affect it. And when we understand these influences, we can better meet our care obligations to all of our patients.